All right, we're going to focus on our next type of hematological cancer, and it's going to be lymphomas. So lymphoma is another type of cancer with neoplasms originating in the bone marrow and the lymph system. There are two types of lymphoma. There's Hodgkin's lymphoma and non-Hodgkin's lymphoma, also called NHL. And so we're going to compare and contrast these types of lymphoma. So Hodgkin's lymphoma, or HL, or Hodgkin's disease is another term used, is a B-cell originated malignancy of the immune system and is one of the most frequent lymphomas in the Western world. This disease accounts for approximately 11% of all lymphomas and is more prevalent in men than women. In this type of lymphoma, there is distinctively abnormally large multinucleated cells called Reed-Sternberg cells, and they're present in the lymph nodes. Hodgkin's lymphoma is commonly seen in younger populations, age groups 15 to 30 years of age, and then it also shows up in older populations over the age of 55. So those two age ranges is where you're going to typically see Hodgkin's lymphoma, a higher incidence of Hodgkin's lymphoma. The cause is unknown, but there are risk factors that are thought to be related to its development. The Epstein-Barr virus, or EBV, which is the virus that causes mono, HIV infection, occupational toxins, and genetics are interacting and thought to increase the likelihood of development of Hodgkin's lymphoma. The disease will typically originate from a single location in the lymph system, with the majority coming from the cervical lymph nodes. Roughly about 80% of people have theirs begin in the cervical lymph nodes of the neck, and it spreads through to adjacent lymph nodes in the lymph system. The other organs that are invaded are commonly the lungs, the spleen, and the liver. When the disease starts out above the diaphragm, it will be contained to the lymph nodes for some time. And if the disease originates below the diaphragm, the disease spreads commonly to other organs, especially the liver. The initial symptom is enlargement of the lymph nodes in the cervical, axillary, or inguinal sites. The mediastinal lymph nodes can also be enlarged. The nodes will feel like a lump or bump and are non-tender. And they typically will be on one side of the body. One side of the body is affected with enlarged lymph nodes, and then those lymph nodes will then invade adjacent lymph nodes. The patient may experience fevers greater than 100.4 and chills, severe night sweats, weight loss, fatigue, and tachycardia. These are referred to as B symptoms because they are associated with a poorer prognosis. Patients may also experience pain at the site of the disease when they consume alcohol, which they don't understand the cause for this, but it is another type of symptom. And they will also many times experience generalized pruritus or itching. The progression of the disease will show organ involvement with splenomegaly and hepatomegaly. And then other symptoms that may develop based on where the disease is located can be, for instance, if there's enlarged lymph nodes in the kidneys, around the kidneys, this can affect the functioning of the kidneys. So it all depends on where the disease kind of spreads in the body. You can see on this man, he has a very large lymph node on his back of his neck and on the side in that cervical region. A complete patient history is important as part of the diagnostics, and so they're going to want to ask about symptoms, risk factors, and other medical history. And then blood studies are ordered and blood samples are taken, and even though a CBC is not super helpful in diagnosing lymphoma, it will still be done as one of the diagnostics. It's also important to rule out possibility of infection, and because many times this is a reason for enlarged lymph nodes. If you've ever experienced enlarged lymph nodes and tender lymph nodes when you have some type of infection. So they will also do an excisional lymph node biopsy, which means that they are going to remove the lymph nodes and do a biopsy on that tissue. They're looking for those Reed-Steenberg cells again, and they're pretty obvious looking when they start looking at that tissue. They can see that pretty clearly. Bone marrow examination is also done to determine the degree of involvement, if there is an involvement into the bone marrow. And then radiologic evaluation is done with a PET scan, and a PET scan is where they do positron emission tomography. They will use radioactive sugar type substance, and they will put it into the body, and if there's cancer cells, this radioactive material will collect in those cancer cells, so they can see that very clearly in the scan. They will also use CT scans to get better detail of tissues, and this is all to help find the sites of disease and determine the clinical stage of the disease. So these are the stages of Hodgkin's lymphoma. The extent and location of disease is measured by the staging 1 through 4. Stage 1 is the involvement of one lymph node. Stage 2 is the involvement of 2 or more lymph nodes on one side of the diaphragm. So they're above the diaphragm possibly. Stage 3 is lymph node involvement above and below the diaphragm. And then stage 4 is the most severe. This is showing involvement outside of the diaphragm. This is showing other organs that have been invaded by the cancer. For instance, the liver and the bone marrow. So that is how they stage Hodgkin's lymphoma. Standard treatment protocols are with chemotherapy, and they will use combination chemotherapy. The most common standard for Hodgkin's lymphoma is the ABVD regimen. So they will use this drug combination of adriamycin, bleomycin, vinblastine, and dacarbazine to treat those standard cases of Hodgkin's lymphoma. If it is a more aggressive type of Hodgkin's lymphoma, they will use another type of drug regimen, BEACOPP. I don't expect you to remember the drugs that are associated with that, but that is the more aggressive type of treatment drug regimen that is used, the combination chemotherapy. Favorable means that there aren't B symptoms present. So favorable early stage disease, they will typically receive about 2 to 4 cycles of chemotherapy. Unfavorable is when there are those B symptoms present, and unfavorable early stage will receive more cycles of chemo, up to 4 to 6. And then once the stage has advanced, they will receive up to 6 to 8 cycles of the chemotherapy. So it all depends on the stage of the disease as to how many cycles of chemotherapy are done. And therapy evaluation will be done through PET scans again and CT scans to see what is happening in relation to the chemo. And they will also do bone marrow biopsy if they need to. The long-term survival rates are fairly high for this type of lymphoma, exceeding about 80%, which is promising for patients. Secondary malignancies can happen. They're always a possibility once treatment has occurred. They can occur many years later after treatment, and so it's really important for patients to continue with follow-up and screenings to detect any further malignancies that might be happening in the body. The most common types of solid tumors that may develop down the road after Hodgkin's lymphoma are in the lung and in the breast. There can also be secondary toxicities occurring from the chemotherapy. So the chemo is very, very hard on the body systems, and we'll talk about that a little more later. For instance, the heart, lungs, and the endocrine system are hit pretty hard by chemotherapy drugs, and so secondary toxicity related to that can occur from the treatment of Hodgkin's lymphoma. Okay, non-Hodgkin's lymphoma, or NHL, is the other type of lymphoma. It includes a group of heterogeneous malignant neoplasms of the B, T, and natural killer lymphocytes. Those are the cell origins. And the World Health Organization has categorized more than 60 different types of NHL. Some common names of non-Hodgkin's lymphoma are Burkitt's lymphoma, reticulum cell carcinoma, or sarcoma, and lymphosarcoma. So those are some common names, but there are over 60 types actually. This type can affect people of all ages. The B cell lymphomas make up the majority of the non-Hodgkin's lymphomas, and these lymphomas are categorized by the level of differentiation, cell of origin, and the rate of proliferation that's occurring. So there's going to be a variety of presentations and a variety of courses of treatment for non-Hodgkin's lymphoma. This is the most common occurring type of hematological cancer that you will see. It is believed that NHL develops from a combination of risk factors, including genetics, environmental factors, such as the pesticides and chemicals we use. Immunodeficiency plays a role, and viruses and bacteria. Again, we're looking at the HTLV, the EBV, herpes virus 8 as another one, Hep B, Hep C, and also H. pylori. So they're thinking there's a connection there with those specific viruses and bacteria, and in combination with other risk factors leading to non-Hodgkin's lymphoma. So the manifestations, really it's an unpredictable type of course with this disease. It can be slow moving or it can be rapidly progressing. The disease can originate outside the lymph system. The disease has many times spread to other areas in the body, or it can be disseminated is the word we use for that, to other parts of the body on diagnosis, which can make it even more difficult to treat. Other symptoms may be present depending on where the disease has spread to. And so it can be, for instance, if you're having spread to this neurological system, you're seeing those neurological symptoms with that CNS involvement. Primary manifestation is going to be those painless lymph node enlargement sites. So painless lymph node enlargement is common with non-Hodgkin's lymphoma. So those patients that have a more aggressive, highly aggressive type of lymphoma, they're going to see more of the node enlargements, and they're also going to have the B symptoms again, the fever, the night sweats, and weight loss. So those are kind of expected as part of the highly aggressive type of lymphoma. And remember, those are associated with a poor prognosis for disease treatment. So diagnostic studies for non-Hodgkin's lymphoma is very similar to Hodgkin's lymphoma. Although we don't have those hallmark Reed-Steinberg cells associated with non-Hodgkin's lymphoma, you're not going to see those on biopsy. They will still have CBCs. They will do an excisional lymph node biopsy, remove the lymph node, bone marrow examination, and then they will take it to another level with more diagnostics, including other ways to look for dissemination of the lymphoma throughout the body, and that includes like an MRI, lumbar punctures, things like that to check for other areas of the body that might be affected. Clinical staging 1 through 4 is used here as well, and this is going to guide treatments and therapy for the patient. Treatment is dependent on the type of cell and the clinical behavior of the cell. So is it a low grade or high grade type of cell, which means low grade is kind of low level, they call it indolent, not growing too quickly, kind of a slower type of development of the cancer, versus high grade where you have a very aggressive, rapidly developing type of cancer. So the treatment is all dependent on those factors.